Good afternoon and welcome to this Govtoday webinar titled Leading the NHS Improvement from Within. My name is Adam Crizzle and I'm the Managing Director of Hillcroft House. I've been asked to chair this webinar, and before we begin, I'd like to introduce our three panelists. Our first panelist is Dr. Paul Coulter. After 12 years of working in the Scottish Highlands in various roles, Paul was awarded runner-up for the prestigious Royal College of General Practitioners Scottish GP of the Year in 2011. Paul is now a speciality registrar with NHS County Durham and Darlington and is currently retraining as a physician in palliative medicine. Paul's early career included representing the North of Scotland Royal College of General Practitioners Group on end-of-life care, as well as being the Highland Medical Society President and Junior Doctor Representative on the local negotiating committee. His clinical roles included being a GP partner with responsibility for patients out of hours. As a doctor with both primary and secondary care experience, Paul says he is passionate about improving the current NHS culture and communication styles. He strongly believes that a change in NHS culture is necessary if we truly want to improve the standard of all patient care. Our second panelist today is Dr. Geeta Hitch. Geeta is an academic pharmacist. Previously, she has worked in a leading NHS Foundation Trust hospital and as a locum in many NHS trusts, as well as in community pharmacy. She now lectures in the Department of Pharmacy at Reading University in various areas of pharmaceutics and pharmacy practice. Geeta believes and would like to think that tomorrow's generation of pharmacists, her students, will have the self-belief and the courage to use their training to improve patient care within the NHS. Our third and final panelist is Shirley Moon. With a degree in philosophy and a postgraduate diploma in information management, Shirley's NHS roles were preceded by a long career in the private sector. Having worked in the world of training, project management and information management, Shirley moved into practice management in primary care, followed by roles in governance. Now, in Milton Keynes Acute Trust, she is the business planning manager in the Core Clinical Services Division. Shirley has had a number of opportunities to help and develop leadership skills both within and beyond the division by introducing courses. These courses have been tailored to meet the needs of both senior managers and of lower band staff. Shirley believes leadership development is important in order to prepare future generations of leaders, particularly in view of the growing awareness of the need for a shift in NHS leadership culture as highlighted by the Francis Report. So, I'm going to put the first question to Dr. Paul Coulter. Paul, can you describe the type of leadership challenges medics in the NHS face, and what do you think the solutions need to be?
Hi everybody and welcome to the webinar. Many thanks Adam for introducing me and giving me the opportunity, and I note that you you say that I'm passionate about improving the leadership in the NHS, and I'm very much that. So I hope I can help, and I can only describe the challenges that I have seen, obviously, because this question is very vast and difficult. I could talk all day on this. So I will try and be succinct and describe how my 12 years in the NHS, how I've realised that we need to develop leadership from within. It could be described, I suppose, for trained medics and trainees. There tends to be a massive difference when you're training with the culture in the NHS, which I will touch on later. Starting from the trained, which is obviously your consultant and upwards, really, if you think about it, the NHS sadly has been increasingly described recently as a slowly sinking ship. It is well documented that cultural change is needed and I refer to a personal view written in the BMJ just 4 weeks ago by a management consultant about this. Very good reading describing how when freezing pay, the cutting of pensions, the extending of the retirement age, and expecting staff to work more was causing a huge poor morale among staff. I'm sure a lot of listeners will be fully aware of the problems that the junior doctors are having with the junior doctors' contract being renegotiated, and the BMA union have had to step aside from that, and they couldn't reach agreement due to the fact that they're trying to extend the normal working days, and they were trying to take away the hours on call, as in extended. There was no limit on them, so patient safety would definitely have suffered. Hence why at the moment it's probably going to be at a standstill. A positive organisational culture can definitely be developed, but this needs to be driven only by engaging the masses of the many. I mean, I don't know how many listening today would think that a thank you could actually go amiss. It is well recommended or recognised that happy staff are more innovative and they work harder. It's very important that staff are empowered, and I have noticed bureaucratic barriers to implementing change in the NHS are huge. I think this is a very important point, and NHS leaders need to change their view on culture. NHS leaders sometimes, and in defence, aren't fully trained in this and maybe lack self-awareness. You can progress up the ladder by just being the one next in line, and maybe you don't know how to handle people. And actually, people handling and people management is a really hard skill, but is a big answer to a lot of the problems in the NHS. I refer to a recent survey, sadly, of more than 200,000 NHS staff, which found that only 69% were enthusiastic about their job, 41% were satisfied that their trust valued their work, and 36% thought communication between senior managers and staff was effective. I thought this was very poor reading, and just to touch on the trainee survey of the GMC, there was a value of 1 in 10 of bullying documented in the NHS. Now, they seem to think that this is much higher because they're going to potentially restructure the questionnaire, because there appears to be nobody going ahead with the reporting of these, and they noticed that by the way that it was designed, the actual questionnaire. And 1 in 10, I mean, is obviously more. It shouldn't be that. It's 1 in 10 to more than it should be, but actually they think that level is higher. I said, with all this previously and highlighted by the Francis report and my own experiences, I have witnessed what could be perceived as unacceptable behaviours, poor communication, and ineffective leadership in the NHS. My colleagues have fed this back to me that through their training, and those who are fully trained experience this. And I always mention when I'm talking on leadership that any organisation that has a bullying, like how to avoid bullying lecture in their first day in induction, really that strikes to me as an organisation that needs help. I mean, a lot of these issues seem to be due to lack of self-awareness and what I would describe as low emotional intelligence. Ideally, I think we would have all our leaders and extended team, to be honest, to do something like a personality like DISC that I have done myself, and Myers-Briggs is another one that's used, but the DISC in particular, and reflect on our own personalities, because our own behaviours influence others. And unless we know about how we are behaving, then I'm not sure how we are able to lead people, which is a hugely important thing in managing in the NHS. This is a stressful environment. I know lots of jobs are stressful, but the NHS is exceptionally stressful. We lose a lot of money and time to illness. I think a lot of it can be helped by good leadership and good management from within. I always go on about mutual respect, and I think this is absolutely vital, and the team need to feel empowered. I refer to the GMC guidelines of the duties of a doctor and management of doctors at the GMC, and it quite clearly states that you should have respect for your colleagues and their own culture and what their own skills are and bring to the team. I mention this repeatedly because I do question sometimes how much we actually practice this as clinicians and medics in the NHS. My experience of it has not been wonderful, and that's why I'm here today, to try and strive to try and improve it, because I'm very passionate and I think we can do it. I do believe that many leaders in the NHS don't mean to be, whether they're bullies or whether bad management. It really depends on your own definition. But I don't genuinely believe there's many that don't want to be good leaders, but maybe they don't know how to be and need help and how to achieve that. It's very timely, this webinar, because it will be noticed that well publicised on the BBC website yesterday about a hospital close to my own for 12 years that has had huge issues with cultural organisation. The GMC are involved, and the Healthcare Improvement of Scotland review has made 13 recommendations. It identified concerns about leadership and culture which were impacting on the quality of care. Sadly, the whistleblower in this organisation has quit due to frustration. It was a cancer specialist who, I can only quote what is documented on the BBC, described staff as like an elastic that is stretched almost to breaking point. There was a toxic culture with low morale, high staff turnover and sickness, with no shared values between management and between who are actually delivering the services. It was felt that undermining behaviour was rife. This is just one example of I'm sure, many in the NHS, and I can't comment on whether this is true fact or not, but I can comment that it was documented and well publicised. I suppose I come back to why I got involved in this. I mean, I saw a lot of these behaviours and read lots of leadership textbooks and attended many management leadership courses. I was happy with, you know, the what and stuff and the why, but nobody had actually addressed me of how to improve things. I think we've a lot of work to do, but I think changes can be made. And when I undertook to look at DISC training and some coaching support, which I see is mentioned already by some of the questions, I personally felt that I was able to feel more empowered in my organisation to take things further. I mentioned previously that a lot of money is lost to the taxpayer due to poor leadership and poor communication skills, and I think this is really important. There's a lot of talks that I go to that talk about just getting more money and more people and numbers into the organisation, but actually I think if we change our behaviours, communication skills in particular, then I think we could have a lot more passionate care. I know when I feel empowered, I am definitely more productive in the hospital, and I take a big interest in communication skills given my current role. I believe in the holistic care of the patient, and when I became a doctor, I genuinely felt that I wanted to do it to help people, and I didn't expect to walk into an environment of ticking boxes and meeting targets. I think one of the key challenges I've observed over the years is the inconsistencies that exist in the way leadership is taught across the NHS. We will definitely only see a focused and productive workforce if we have quality and consistent leadership. Getting the leadership right at all levels is the key starting point. This is about improving communication, which will enhance the way we work and what we do for our patients. I believe, to conclude, I can't answer the question in massive detail because it's got so many different avenues. However, if we just focused on one point about recognising our behaviour, our communication skills with others, and how we empower a team to make them feel that they can take things forward. Why is this sort of thing not in an induction or even in medical school. There is some talk about medical schools getting this sort of training and coaching into medical school, but obviously that's a long process. You will also appreciate that change takes a long time. However, instead of having a Boolean course, which is of course very important and useful, why not have something about our self-awareness in ourselves, in our leaders, and hopefully we could take things forward. I hope some of my views have been helpful, and some may relate to what I've been through and what I've seen in others, and it does disappoint me, but I think if we keep trying and more people listen, then slowly but surely we may get there. As I say, it's just within our grasp, and if the ideas from this Transforming Leadership Culture seminar were applied to the NHS, I genuinely believe that we would see a direct impact on improving patient care and greater savings within the organisation. Thanks very much.
Paul, thank you very much for that. That was really helpful, and I think with some of the questions from the listeners so far, I will raise those towards the end. So thank you again. But at this stage, I'd now like to put my second question to Dr. Geeta Hitch. So Geeta, as an academic lecturer at Reading University, can you describe the type of leadership challenges that newly qualified people coming into the NHS might experience, and what additional skills do you think they need to deal with them?
Hello, everyone. Thank you very much for that introduction, Adam. In answer to your question, I believe that having worked within the NHS, I found it a very structured and a hierarchical organization. Now, this for me meant that at every level of hierarchy, there was a different style of leadership and management. And the person who comes in, if they're new into the NHS, will be faced with these different types and styles of leadership and management. So, if you're new to the NHS, then you will need to be able to instill in yourself the skills which will enable you to respond effectively and unhindered by the different management styles. For example, for me personally, when I joined the NHS, I found the tiered level of hierarchy overwhelming, to say the least. We all need managers in places to maintain a productive workflow, but this was something completely different to me. I went into the organization, I was extremely motivated, and I would like to think that I'm a very strong character. And any job that was thrown at me, I was willing to do. I was told by 3 different people at any one time about what to do, how to do it, and what the deadlines were involved. Now, for me, this didn't present a problem. I went along with anything that was asked of me, and I couldn't say no. And worse still, for me, I didn't say no. What was amazing in hindsight, having left that job, is that I realized, now having undergone Adam's masterclass in leadership and the one-to-one coaching, how much of a poor leadership and poor management I had been on the receiving end. What was worse about all of this is, not having had the appropriate skills, I tried to cope with it all. And what was incredible was that I received no constructive support. So one of the things is that if you're new to the NHS, I would actually advise any person going into the NHS is to have these skills on how to manage and how to organize yourself before you get into that hierarchy of different types of management. All I got where I was when I was doing, why I was doing something was, oh, she's doing something which is not correct. All I got was constructive criticism instead of support. I actually tried to get the problem resolved, and I didn't get anywhere even with the senior managers, because all I was told was, put up with it, she's your line manager, and do as you're told. And the actual straw that broke the camel's back was there had been a project that had been put on the back burner for the last 7 years until I came along. And I responded to a query from one of the people who wanted me to help out with a project. So I did, and I did a wonderful job on that. And you wouldn't believe what happened to me after that. My line manager just turned on me. Instead of praising me or saying, thank you very much for getting that job done, we needed it done, all I got was I got reported to the HR, which I found really incredible for actually completing a project that required completion. So I feel that had I done this masterclass a few years ago, I would have been armed with the skills to have avoided a lot of these situations. I would have had some strategies and ways to deal with these people. I do sincerely believe that in the NHS, where you have so many different types of healthcare professionals working all together, and you have different professions coming together to pull together and improve patient care, every different department has a different manager, and they all come with a different mindset. What I do think we need is a common sense of training with all of these managers, all in one group, all at the same time, telling them that it is their behavior that impinges and it hinders the productivity within the NHS environment, because quite a lot of them, they are all very clever people, otherwise they wouldn't be there. However, they, in my experience, the ones that I came across, have had no sense of self-awareness, and this is what Paul Coulter was pointing out earlier on, that they don't show any respect to the colleagues, and the environment is actually really quite toxic to work in, and that isn't very healthy for anybody, really. They need to have more need for self-awareness, and they need to be made accountable for all of their actions. I saw none of this happening, and I think this is where, if you are going into the NHS, you really need to have those skills to be able to cope with those types of managers and those types of behavior. When I left the NHS, I felt a failure, because that's how I was made to feel. Now, no one should be made to feel that way. If these people had the proper training about what leadership entails, about what management was all about, how their behaviors actually affect other people's work and their lives and their careers, to say the least, they wouldn't be doing that. Everything I did, I was made to feel it was wrong. Whenever I asked for any support, I didn't get any. And I think this is where the leadership in NHS fails everyone, not just the patients, but the people who work in there. After having done Adam's masterclass, I realized that I had a lot of issues around my circle of concern, and I had felt, had I had this training before, I would have probably put this to one side. And what I realize now is that this circle of concern was seeded, and it was made larger and larger by my managers, and it shouldn't have happened, and it needn't have happened. But this meant that had I been aware and I had the right skills to cope with this, I would have focused on doing my required chores, accomplishing what I could within my capacity, learning to say no to being overworked, and asking for support. Instead, I got browbeaten into being told repeatedly that I was just a junior member of the staff. I was felt to made worthless. And I just had to walk away from it all eventually to retain my sanity. And it is a real shame, because I really did enjoy that job. But now I have turned a full circle. I'm now more focused on all the things I can influence about my life. I have regained my self-confidence out of all of this. The challenges are that the leaders do not recognize their behaviors, and instead they're all focused on meeting their targets all of the time. So the NHS actually does fail the leaders, I think, and the leaders then fail their staff in turn. The leaders, they forget they're dealing with human beings all the time, and in the process they create a working environment which is sometimes unstable, is non-communicative, it's unproductive, and it's always a tense atmosphere, because you always have somebody breathing down your neck. Now, how can this be good for improving patient care? it is not right that some of these managers, they genuinely believed they were too far high up to work, even when there were staff shortages or help out in the job that they're originally qualified to deliver. So I really feel that I couldn't educate my students unless I had the T's crossed and the I's dotted by at least 3 of the staff within that kind of environment. It was unbelievable. The control they had over the junior staff was incredible. There was no autonomy allowed. You weren't allowed to breathe. I used to get an email even if I went to the toilet, and this is absolutely true. I received an email and it said on the email, if you're going to be away from your desk for more than 10 minutes, can you send me an email and let me know? It got to the point of being utterly ridiculous. Now, these are the sort of people who actually are in positions of leadership and management within the NHS. These are the people we actually look to for improving patient care. How can patient care be improved if this is how they treat the people who are genuinely interested in improving patient care? This is what I put forward to everybody, that you really need this training across all levels of leadership, at all different levels of leaderships within the NHS, and all the managers as well. But I also think that even if you are a junior staff, you should be exposed to at least some of the elements of this leadership training, because it gives the junior members of the staff an insight into how the senior members are operating. It actually gives them the skills, and it gives them the tools, the correct tools, to engage with the managers when conflict situations arise. And I feel that this kind of training is sadly lacking within the NHS. They have all sorts of other training, but I think the training that's most important about self-awareness, about self-behavior, and how this affects other people is completely missed. And I really do think this is where the NHS really does need people like Adam Grizzle and the Hillcroft House. Thank you very much.
Okay, Geeta, thank you very much. I'd like to just pick up, that was really helpful, thank you. I'd just like to pick up some of the questions that have come through already. A comment's come in from Megan Harris, who said, a major issue is also the constant changing of the NHS systems. This makes the hierarchy changes and shifts leadership styles, leadership teaching at all levels, not just in medical school, needs to map across different ways of working to support people. So that works nicely. So thank you, Megan, for that contribution. Actually, a new one's just come through from Elaine McRate. Do you think these leadership problems are unique to the NHS, or do you think it's endemic due to education? Elaine, that's a very interesting question, so thanks for that. There's some other questions here as well that are from listeners, but I'd like to, at this moment, just move on to Shirley Moon. Shirley, you're there at Milton Keynes, Business Planning Manager. You've done a lot there on training that we've already that we know about. So in view of the work that you've achieved at Milton Keynes, Shirley, can you describe the training programs you've implemented, how you did it, and what do you believe the bottom line benefits have been?
Yes, hello everyone. Thanks for inviting me onto the webinar, Adam. As you mentioned, I work for the Core Clinical Services Division here at Milton Keynes, and the division's had a long history of developing the service heads through away days covering a range of leadership and management topics. We also all received our DISC psychological profiles several years ago, and we've continued to use the DISC profiling techniques. Our general manager is very supportive of this, and it's proved to be a very useful tool. Steve Melville came into post 2 years ago as general manager for the division, and he wanted to develop the next tier down. So the people he calls the shoulders, not just the heads of services. And we've had away days for them to look at what leadership means, how their own personal leadership styles can be developed, and also what influences those styles, including emotional intelligence, which I think is very important to stress. The divisional triumvirate, that's Steve as general manager, along with our divisional director and our AHP lead, also issued a pledge to staff this year. They all signed it, and a copy was sent to everyone in the division. It outlines their commitment to improving communication, listening, encouraging career development, developing better leaders and meeting workforce requirements such as mandatory training and appraisals. Steve also had the idea of starting a management awareness program, or what we call a MAP course, which all of those involved in have been really proud of. Steve wanted to be able to offer leadership development to Band 1 to 4 staff who don't usually have any access to that sort of development. So as well as Steve and myself, there are 3 other managers who train on the course, and we cover an introduction to leadership, management, customer care, governance, patient experience, and the trainees also do the best of the best DISC training as well. We only take a few trainees at a time, just 4 or 5, because we also mentor them. Each trainer's got a trainee that they mentor, and we give them opportunities to shadow us and attend meetings and things that they wouldn't normally access. And we've had that course accredited. It's through the Bedfordshire University. It's to the Chartered Management Institute Level 3 Award. So that means that the trainees have got something real to put on their CVs. It's not just one of these attendance certificates to show they've managed to sit in a chair for relative number of hours. Our first cohort passed the accreditation with flying colours, and so we're now working with Beds Uni to see what more we can do with them. The benefits of all these initiatives mean that the Trust has staff who are looking forward in their careers, considering the possibilities before them, and in some cases having new possibilities opened up, and in some cases it's just helping staff to do a better job in the position that they're already in. So it also fits into the Trust succession planning. We're developing the leaders who will be taking over when those already at the high levels have moved on.
Okay, so that's really interesting. But if we take this Best of the Best program, can you describe for us the difference it's actually made at the hospital?
Yeah, I've delivered 15 training sessions altogether now to different size groups and in a few one-to-ones as well with people. And I think it's made a really positive impact on everyone who's attended. Certainly the feedback's been very positive. And I think the differences it makes are both personal and to teams. So on the personal level, when I'm doing the training, I can really actually, it's almost you can see the penny drop with people, and when you start to explain things like emotional intelligence to them and tell them about the personality traits within the different DISC profiles. Many people have never heard of emotional intelligence, and the whole concept really opens them up to thinking about their own behaviour and the effect that they have on others. When they learn about what high and low levels of emotional intelligence look like, it actually makes them want to display the high-level traits. They start to realise, and think about their own behaviour and what they've done in the past. And then the DISC profiles gives them a structure for understanding how different people are likely to behave and how to deal with people. One of the things that I explain in the training is that we have a tendency to assume that everyone has the same motivations, fears, responses to change and so on as we do ourselves. Sometimes we don't know how to react when we're met with incontrovertible proof that that's not the case. So this training makes people much more conscious about how they need to adapt themselves to achieve success. On the team level, I've trained 3 larger groups. So there's our finance department, our hotel services managers and their team leaders, and also our screening services team. And it helps those groups to see what their uniters' strengths are and how to utilise the different psychological profiles within the team to be able to be successful. So all the DISC profiles are equally valued and respected, and each have strengths that are necessary to the group as a whole. So the training helps the group to see that they have to embrace those differences in order to be fully effective. And then for managers, it helps them to determine the profiles of the people in their teams and to respond accordingly so they can use them to the best advantage.
Okay, that's interesting. Do you think the improvements you've identified would have happened without the programme?
That's really hard to say, but not that I'm aware, because we're talking about things that people, haven't usually heard of before. And I don't know that there is any training comparable to this, which helps people to make really practical changes in their behaviour in order to achieve success.
Okay, could you then summarise the key areas that you teach on the programme, and how long does it take you to deliver it?
Yeah, sure. There's 2 core topics within the Best of the Best programme. One's emotional intelligence, what it is and what it means to have high or low levels of emotional intelligence and the effects that has on yourself and other people. And then there's also the DISC profiles. Excuse me. As well as attendees getting their own psychological profile, They also learn how to predict other people's profiles and how to use these to improve the way they communicate. So the initial course actually takes about 2 hours, but then I've quite often been asked to go back and talk to teams that have all done their DIS profile together and look at their group profile, what it means for the way they're perceived from outside of their department, and also how they work together. And because I've now led quite a few of these Best of the Best programs, and I've become more knowledgeable about DISC, I can sort of go further with my explanations to people about what the profiles mean and how to use them. So that's added sort of another dimension to the core training, and it's also enhanced my involvement and my enjoyment as a trainer.
That's great. So how easy do you think this program would be to implement in any hospital? So really what I'm saying here, Shirley, is this easily transferable?
Yeah, I'm sure it is. The program's really about enabling people to understand themselves and to understand others, and that's a universal interest. I've had a long career, and I've worked in over 20 organisations, public and private sector, as you mentioned in my introduction. I can't imagine any area, large or small, where the problems of communication and differing personality styles don't exist. Nobody works in isolation anywhere. So the program's been easy for us to implement because you've got that interest in it anyway. And it just takes some initial training to help to get to know the presentation and the background information to it. And then really you're off. Admittedly, I've got training and presentation experience, and you do need, some confidence and skill in those areas. But that could be developed alongside actually learning the program for people who are, perhaps not got that. And we do have other DISC trainers in the trust who are less experienced than myself, and sometimes work with me to help them to gain in confidence.
Okay, that's really helpful, Shirley. I've got another question I'd like to put to you in views of what you've just been saying, but there's a question that's come in here from Angela Gardiner, and she's saying here, is the training any different for clinical teams versus corporate teams such as finance?
No, it's exactly the same, because it's about personalities and behaviours. So it's not about, saying, oh yeah, you must be different, behaving differently because you're in a different department or a different discipline, because everybody has the same sorts of behaviour patterns. So it's about understanding ourselves, understanding the effect that we have on other people, and being able to, use that as a team to be able to play to your strengths. Okay, that's really helpful. Yeah, no, I think that's answered the question. I hope Angela will be satisfied with that. I just want to put a bit of a wider question to you, Shirley, in view of everything you've just said and what you've done and what you've achieved. And maybe to an extent I'd like to widen this with Paul and Geeta if you'd like to contribute. But with yourself first, Shirley, the King's Fund report, I'm really looking into the future for the NHS. So the King's Fund report titled Priorities for the Next Government refers to a focus on reform from within. The report states, a quote from it, there is compelling evidence that organisations with high levels of staff engagement, where staff are strongly committed to their work and involved in decision making, deliver better quality care. Instead of mandating change from above, the next government should promote reform from within, based on devolution and transparency. Now, some of those points, Paul, you've already referred to, and so have you, Geeta. Yes. So I want to put this to you first, Shirley, and this really question to all of you. Shirley, if you could kick off on this one, in view of the way you in particular have created change in your organisation, and Steve Melville, and were you actually delivering it at the sharp end, shall we say, how do you think the next government should actually promote reform? I think that for change to really result in better quality and better patient care, it's got to have buy-in for the people who are delivering the service. In our division, our triumvirate really think it's far better to engage staff and give them the tools or training if that's needed, and then empower them to make the improvements, rather than, you can't just impose it, and it's no good just sort of like handing it over and passing the buck. We need to make sure staff are able to be involved, have an understanding of the issues, and that senior managers have to communicate and listen and develop staff, just as my triumvirate has pledged to do for me and for everyone else in core clinical division. but I think government should support this. They should enable trusts to engage staff in initiatives to improve patient care and to look for local solutions to local problems, as well as having the forums and mechanisms to share those initiatives that work well.
That's really helpful. Thank you, Shirley, for that. I'm going to put the similar kind of question to Paul and Geeta. What is your take on that? Because I think it is an important one. What is the government going to do into the future? Because my understanding, what everybody's saying is that it's got to be self-awareness is a theme. If we look at the themes that the three of you were talking about, there's self-awareness here. There is conflict going on in the NHS. All the evidence is showing that. But looking into the future, you're talking about this has to come from within. So, Paul, the same question. What do you think the government needs to do?
Basically, Adam.
Yeah, Geeta, yeah.
Oh, sorry, Geeta, you go for it.
Oh, sorry,
yeah.
Paul. Do you want to go?
No, please, Geeta, please.
Go for it.
Okay. Well, I mean, I really think that it's very, very important that the education of leadership and the skills is brought in. Firstly, I think it starts with the institutions of education. And then the government should look at when people are being employed within the NHS, what sort of standard levels of training should be met. And I think this is where the leadership skills come in, whether the management skills come in, and they should be tiered for all different levels of the staff. So, for example, the healthcare staff, if they're going to be managed by really high top team leaders at the top, there should be a level of training that's targeted specifically for that tiered level. And then certainly for the junior members of the staff, I do feel, and they have, without them, the NHS wouldn't be functional. I do feel that these are the people who also need an exposure to education of these leadership skills and how the managers behave, so that they also know how to, in return, to behave and handle the behaviors of their managers. So I do believe that it should be instilled within the employment section itself, and once they're employed, they should complete the mandatory training, and that's where it should come in.
Okay, thanks, Geeta. Paul, a question's actually come in from Elaine McRate, directly for you. And what Elaine's saying here is, does Dr. Coulter feel that the conflict between medical and others is more professional conflict? Would better leadership skills overcome this? What's your take on that question, Paul?
Well, first of all, I'd like to thank Elaine for that question, because I actually have a bit of interest in this. I must say, when I started 12 years ago, 13 years ago, there was conflict between the multidisciplinary teams, medical and others, and I totally agree with her. I think it's the hierarchy system which sadly still persists to this day. Obviously, people who are approaching retirement, medical team will say, oh, back in my day, it was a lot worse. It was an awful lot worse. The nurses did this, the doctors did this, the physio did this, the pharmacist did this. However, I think it needs to be remembered that was a different culture, and we're now living in changing culture, and everything changes with time. I think better leadership to some extent would help this, but I think it's such a difficult thing to answer, because a lot of this comes down to mutual respect. I'm very black and white and quite simple with these sort of things, and I'd love to tell everyone listening today about the fact that when I mentioned our GMC guidelines, which doctors are bound by, talks about mutual respect for the professional team, and that includes everybody that we work with. I just wonder, if it's written down and it's meant to be the code we're practicing to, why is it not as simple as just saying to people, practice what you're meant to do? And I'll just leave that question with others. And to answer the question, Elaine, I think there is an element of professional conflict. I think there's an element of I know best, hierarchy system, and I think that needs to be dismissed, and I think it needs to be dealt with. It can be dealt with good leadership, but again, are they willing to challenge a consultant if they're a manager? It's a really difficult one to answer. That is where, obviously, good training days out and all work. If people are motivated to change, it has to be remembered that those need to have the motivation to change. And as I say, I could hog the phone for hours on this topic, But I think if I go back to, we're actually meant to all be respecting each other anyway. So it's simple to me. Why don't we just do it? And I'll leave that with you.
Okay, thanks for that one, Paul. I wanted to throw this one back to Shirley, if I may. Megan Harris has brought a question into the discussion now. She says, development of staff does cost money and time. Is this a possibility to expand? Is it possible to expand this during times of austerity that we're going through now? So, I mean, we've got just before you answer actually, my take on what everybody's saying so far is that, particularly what Paul and Geeta were talking about, is that we're losing a lot of money and time, and Paul talked about that quite a bit, that we're losing money and lots of money, we're losing lots of time because of ineffective leadership. But Shirley, what's your take on this? Is this a possibility to expand during times of austerity?
I must admit, my first thought was, can you afford not to?
Yeah.
I mean, you know, in terms of austerity, unfortunately, staff training is quite often the first thing that gets sacrificed. And, you know, when we know that we've got issues and we're told that we've got to do culture change, you know, really we've got to try and make some priority to be able to do some of these things.
Okay. That's fine. Geeta, let me just throw one to you. Rally Mansat, I hope. I do apologise, Rally, if I've got your pronunciation wrong. But the question he's put in here, if you are to play an effective role in leading improvement in the NHS, how would you challenge yourself? Geeta, can I put that to you, please?
Yes, you may. Basically, if you are going to play an effective role in leading improvement in the NHS, what you need to do is you need to start with what the current culture is. You need to understand what's exactly going on within your department, within the area that you're seeking to improve the leadership. So if you want to do that is the point, I think, and that is in itself a huge challenge, because what you will then find is all sorts of problems that have been left unresolved coming to surface. So that's the area to start, and then you look at what areas within your organization, you know, where are these problems emanating from? Who are the problem people? And you will usually find that it is people in the management who are actually creating the problems, and that is what we were saying going back to previously when I said that, you know, to an extent, the leaders are all very, very quite clever. They have high emotional intelligence, but it's the low emotional intelligence that takes over, and that's the lack of self-belief. They're actually frightened, and they worry about not meeting the targets. They worry about everything else, and they transpose all of these things by exhibiting bad behavior and treating the staff in the way that they do. So I think these are all the challenges that you need to actually look at, and then you meet them. But again, that in itself is a huge challenge to start with as well.
Okay, thanks for that. Perhaps if I could just put this question to Shirley, what's your take on this? Sebastian Hendricks has put a question in. The creation of competition does not enable working or developing services across different service providers. How can we as leaders enable this cross-working, which is in the interest of patients and staff who want to do the best to their patients? Is that something you feel you would like to answer, Shirley?
Yeah, I think really it does come down to leadership development again, because what we core clinical division at the time in is a very sort of like widespread. We've got a lot of different disciplines within it. I think we've got about a dozen different disciplines, and it really does come down to looking at the basics together about what leadership is, in order to be able to do that cross-pollination and sharing ideas, which then we can feed into improving things for patients and staff.
Right, okay. Yeah. Okay. There's another one, Shirley, if I could just keep you on here for a moment, because Janice Hostad from Castle Hill Hospital says, I run Band 5 and separate Band 6 training courses and work hard to provide evidence of the learning, which I guess everyone finds quite challenging. So Janice's questions are relating to an evaluation and audit. What methods have you used to measure the success of the training? How do you know that they put the learning back into practice? And how do you know if they have retained this learning over a period of time and variables? And how easy have you found it to prove that these changes, given the many possible variables that exist? There's a lot of questions there, Shirley, but I think what she's really talking about is the sustainability, if I'm reading that correctly.
Yeah. Well, we first actually did our DISC profiles as a leadership team about 7 years ago, and we're still using them on a regular basis, and we still find it really helpful in terms of helping to form teams, to communicate with each other. When we're actually doing a project that's going to go across the division, we consider those DISC profiles when we're putting the team together to deliver that. And we've also used it to help with performance management. We've used it to help when we're hiring new staff. It's just something that has become, embedded in what we do.
Yeah, so it's very much embedded into it. Yeah, okay.
Yeah, it is. And certainly since I've been training on it, which I haven't been doing for the past year, this is more of a sort of soft intelligence really at this stage, but I do get a lot of feedback with people coming and telling me what a difference it's made, how it's changed the way that they've approached doing something when they've had perhaps a difficult staff issue to deal with, how using their knowledge of the DISC training has helped them with that.
Okay. I'm going to put this question, as we're moving towards the end of the webinar, I'd like to put this question to all three of you, and perhaps if I start with Paul, and this is a question that's coming from Richard Gray, and Richard says, I would be interested to hear the panel's view of the role of coaching as part of leadership development and their experience of how it is currently deployed within the NHS. So Richard's view is that due to high workload, there is a real risk that no time is allocated for managers to have coaching conversations or to deploy more formal coaching initiatives. Whilst understandable, this is also short-sighted, and we pay later by impairing the development of all staff. So I suppose in essence, as a précis, what Richard is really saying, he's interested in your views on the role of coaching as part of leadership development and your experience. So can I start that off with you, Paul?
Thank you very much. I think it's a fantastic question. I mean, and actually it's hit the nail on the head. I think that is my view on where we go wrong here. Coaching, the answer to the first part of the question, do I feel coaching's got a role in this? Well, it definitely does. It needs to be persistent, and it needs to be well delivered. It also needs to be accepted, but it also needs to be maintained. And I think that's where I come into this, because coaching will always help me, and I'm always going to need it. Do I have the time? Well, no, I don't. And this is where it's falling down. Am I given time? No, I'm not. This is short-sighted. I completely agree. This is what needs to be recognized, and this is the core problem. There's no point in going to a coaching day down in London for one day and then back and expect to be a new change, to be able to change a team and make massive changes and empower your team and your staff. That is not going to happen. Everyone needs to be doing that, and I totally agree with the gentleman that it is very short.
Gray, yeah.
Yeah.
Okay.
Gray, yeah.
Let me throw that same question really on the coaching to Geeta, to Dr. Hitch. Geeta, could you answer that, please?
Yes, thank you, Adam. And thank you, Paul, for your input, because like you, I really do believe that in answer to the first part of the question, there is definitely a role for coaching within the NHS. But the problem here is where do you find the time? And, how do you get back, as you're saying, and start implementing the changes straight away? You're not going to find that. And I think that one of the ways that the NHS Trust can overcome this, or at least start instilling this kind of training, if you like, is within their clinical governance days. Because I know for a fact that when their clinical governance days, you do shut down part of the hospital services. And I think it is within those days and during those times that such type of training can be implemented. So in my belief, nothing is impossible, really.
That's great. Thanks, Shirley. That's a really positive tone there, Geeta. Thank you. Can I throw the same question, Shirley, if I may, to you, good self, on the coaching? Because you're actually involved in effect, delivering some of this coaching as well. So
well,
how do you manage that?
I agree with Paul and Geeta's responses there. I think one of the difficulties that we have within the NHS is that although training to be able to do coaching is quite readily available, it seems to me, it's not necessarily quite a requirement of managers to have to do it. So, you know, whether or not they are capable or competent at being able to coach the people in their team, you know, is fairly random. So, you know, if they're not interested in doing it, they've not necessarily done the training to have to do it. So I think that's probably a big issue really for the NHS. But certainly I think it's a key part of developing staff and also developing our future leaders.
That's great. So in summary then, you all believe, you're all saying that in answer to that question, that the coaching side is important, it's needed. As far as some of the themes that have come out that I've made notes as you've been talking, you're talking about emotional intelligence, you're talking about self-awareness, and it's quite a bit of a journey still to go. So there are some more questions, but I think we're coming to the end of the webinar. I'd like to take this opportunity to thank everybody who's listened in. In particular, I'd like to really thank our panelists today, Dr. Paul Coulter, Dr. Geeta Hitch, and Shirley Moon. So thank you very much for making the time, giving up an hour to dedicate to this. I appreciate all of that. And, of course, thank you to Govtoday to hosting this as well. So best of luck to everybody, and thank you again for listening. Thank you. Bye-bye.